It's World Immunization Week, and it is usually celebrated in the last week of April, and it aims to highlight the collective action needed to protect people from vaccine-preventable diseases. The aim of this week is to increase awareness around the benefits of immunization and also to encourage people to get vaccinated. This year, the day is observed from April 24th to April 30th and is an important effort to help prevent the spread of deadly diseases around the world. The theme for this year's World Immunization Week is the Big Catch-Up, and it aims to emphasize the need for countries to accelerate their progress towards ensuring that everyone, particularly children, are protected from preventable diseases. Well, joining us now to discuss the significance of this week is General Manager and CEO, Nigeria Solidarity Support Fund, Dr. Fejiro Nwoko. Good to have you on the show. Just in reading that and talking about the theme of this year, which is the big catch-up, I think the first question that jumps out at me is the fact that, Nigeria has only just recently approved the R21 Matrix M malaria vaccine developed by scientists at the University of Oxford. This is coming just a week after Ghana did the same. Absolutely. Now, how important is that, for the future? I want to believe the goal of, vaccine, trying to make sure that a significant number of children are vaccinated against a disease like malaria, which has a very high mortality rate in our country.
Thank you very much, and thank you for having me. That's very, very important, because vaccination, as we know it, is the most successful and most cost-effective public health solution ever. It's responsible. Vaccinations and vaccine-related diseases are responsible for the highest cost of under 5 mortality in the world. And so we have 2 to 3 million children dying from vaccine-preventable disease, and over 20 million children suffering from this disease. So it's very important that a disease like malaria, we've gotten to a point where there is vaccination against the deadly disease malaria. Malaria is one of the top killing diseases of under 5 children. It's very important because then we can save lives and we can also save costs of managing these diseases in Nigeria. This week is important that we'll join our voices to the global voice, even as a country, because we know that Nigeria contributes about 14% to the vaccination coverage deaths, under 5 deaths, as a result of vaccine-preventable disease in the world. Nigeria alone contributes 14%. So it's very important that we talk about vaccination, how to increase vaccine coverage, how to prevent under 5 mortality, and how to treat to use our resources more cost-effectively than having to treat the disease when it happens. So it's very important.
Oh, thank you. I'm just wondering, what are the peculiarities when it comes to immunization in Nigeria? And by that, I mean in terms of challenges that has made us contribute so much, 14%, that's quite significant. Yeah. And how you are adjusting your approach or customizing your approach to address those peculiarities based on what we have on ground.
Okay, I'll look at the peculiarities in 3 ways. First is the access to vaccines themselves. For you to be able to vaccinate children, you have to have the vaccines available. So we have low access to vaccines. And when I mean low access, I mean everybody, not just you and I in the city of Lagos. I mean the rural areas and the suburban areas. Secondly is that we have hesitancy issue. What we call vaccine hesitancy issue is where people are scared of taking the vaccine due to one myth or the other. So people are refusing to take the vaccines even when it's available. And thirdly is research and development. We don't invest a lot in R&D, and to be able to either produce vaccines locally, we have to be researching and developing our own homegrown vaccines. Those are the 3 challenges presently plaguing Nigeria, making us contribute that much to the global burden of preventing diseases through vaccination. And if we can address the access issues, one way to assess this is to produce locally. Most of the vaccines we use now are not produced locally. So if we produce locally, we can address the access issue. Even when they come in, we can also strengthen supply chain issues. We know Nigeria is a very large country and there are a lot of challenges to supply chain. If we address addressed that issue, we have also addressed accessibility. And then demand is a huge ballgame. We saw when COVID came in, a lot of misinformation out there, and there's a lot of distrust again from the public to either the government, which are the ones that push the vaccinations, or to the healthcare workers that give the vaccination. There's a lot of misinformation and a lot of distrust, and we have to unpack that power. Why are people not taking vaccines? Why are they not well educated? Why don't they trust the government? What is the risk? Rather their child dies of measles or dies of tetanus or dies of pertussis or dies of malaria than to take a vaccine, or die of COVID than to take a vaccine? Why are we rather insisting on this misinformation rather than on looking at the wins that vaccines have given us in Nigeria?
I want to follow up on something you said, talking about the production of vaccines locally. That really piqued my interest. Now, with what NSSF does, I'm curious to know if, especially talking about the theme this year, which is the big catch-up, if there's any policies that need to be put in place, or even partnerships with the private sector and even the government to begin to start steps in being able to produce these vaccines locally. And also, I want to know what the message is for the audience for this particular week. What is the NSSF trying to tell the Nigerian people as regards vaccines and the importance of immunization?
Thank you very much. Nigeria Solidarity Fund is an NGO, a non-governmental organization, and our focus is to strengthen the health system. And one way we have decided to strengthen the health system is to increase immunization coverage in Nigeria. The way we are doing it, we're taking it at the leadership and governance level. So you spoke about advocacy, how we're advocating for things like this: increase the vaccine production, increase the vaccine access, reduce the vaccine hesitancy, increase program coverage at the community level, where they'll be able to hand over robust information that keeps the mother or keeps the father well aware of the use of vaccines and how vaccines prevent disease and health. So NSSF is playing at the governance level. We're working very, very closely with the National Primary Healthcare Development Agency to work in states that have zero-dose immunization coverage and states that have low performance in immunization to increase the rates. You spoke about local vaccine production. One way to increase vaccines in countries, first to produce locally, so we have to invest in R&D, research and development, on how to produce our homegrown vaccines. Another way is to have technology transfer. Have agreements with countries, with some corporate organizations to transfer their technology to us, and then we produce the technology here. That will be cheaper, that may be faster, and that will boost the access of vaccine. Homegrown vaccination may take time, but it's worth it, because at the end of the day, you have your own product that works and you've tested amongst Nigerian people and may be very effective, and you can also then give to other countries as a technology transfer as well. So those are ways that you can increase access and that you can increase production in country, and that will definitely reduce the gaps that we have and will catch up. So our message generally as NSSF at this week is a message to everyone. First, on the individual level, get vaccinated, get educated to the point where you can weigh the pros and the cons and see what are the challenges. Why are you not taking this vaccine? Ask yourself that sincere question. Is it because of something somebody has said? Have I seen someone that suffered from that myth and facts that I've not verified? Why am I not? So get vaccinated, get educated, get vaccinated. We're also speaking to healthcare workers, because they're the front line. They're the frontline people, and without their help, these vaccines will not be accessible. Increase vaccine services. There are some places that don't have primary health centers. We need to increase vaccine services in those places by outreaches, by putting up a campaign, by going into the markets, going into the community, working with the rural community leaders and the religious leader. We have to increase vaccine access. Those days, vaccines in the hospitals are once a week. That's the only time they open the vials. And if you don't come on that day, you don't get. But in 2023, I'm sure there are ways we can work around increasing the services. And lastly, to the government, is everything rises and falls with leadership. if we increase accountability and monitoring and evaluation for vaccination programs, especially outreach programs, then we'll be able to say where are the gaps, where are the areas in which we are not using the resources efficiently, and where can we redistribute resources. So I would say to the government, closely monitor the vaccine outreaches and programs in country, and let's evolve, let's make changes based on what we have measured.
I know you can't do everything, but when you mentioned the hesitancy issue,
yes,
what came to mind was culture. How huge a role has culture played when it comes to this? Because some people are set in their ways to a large extent. And do you think that maybe collaboration with maybe some those in the traditional setting, like maybe the rulers or those, I don't want to say town criers, but those who have good influence in their communities could make when it comes to helping out with
Absolutely.
this?
I feel like you've answered the question. I feel like you can even run a vaccine campaign right now based on what you've said. Definitely, we have to do everything with partnership. I mentioned the issue of distrust and mistrust, and we saw it vividly in COVID. Mm-hmm. There is a lot of, we don't trust each other. We don't trust the governments. Yep. We don't trust foreign experts. They wouldn't even trust me, even if I go to my village. I'm sure they wouldn't trust me because they've not seen me in years, right? But when you meant community leaders, people that they see every day, people that their word means something to them, when they speak to them, I have a family member that refused to take the COVID vaccination until a senior friend, and this is my family member, and with all my talking, they refused. But a friend that has been with her almost all her life told her that, oh, you know, we vaccinated our children and nothing happened. We may as well take this COVID. And that's how she took it. And this is me being the doctor in the family. So people that they trust have to be the ones communicating this information in a manner that they can understand it. Then communicate it in a robust manner. Vaccines are not one time. There are top-up doses. So a lot of the time we have people that are taking one vaccine. Oh, they say, I vaccinated my child, but how many? There's the extended vaccine program of the country. So how many have you taken? In what doses? Did you take it at the right time? You know, we have to educate fully, but the loudest voice have to be the voice that they trust. So people that are around them, really just rulers, have strong influences on people. Community rulers have strong influences. Family and friends have strong, so we can use the media like we're doing today.
Doing right now.
So that's why I say you can champion a vaccine program. So we have to put its partnership. And then again, there are people, that corporates, that may not be able to speak to these people directly, but they can fund initiatives that speak to these people directly.
Definitely. You know, just to bring it back to what this theme is for, still talking about, you know, catching up. Now, I mean, I like where we've gone with this, talking about, you know, vaccine hesitancy, because when you even begin to look at the figures here, it is said that about Nigeria still falls short of the goal that it sets, with only 57% of children still being immunized in the past 5 years. Do you think that outside of trying to, you know, I guess, have the local leaders and cultural leaders on board and trying to communicate with them, because we are looking at millions of children dying because of, you know, lack of education, should it be something that should be put into law? You know, how do we balance that out? Whereas we understand that this in itself is what is going to save these children, and the outreaches themselves are not doing the doing the work fast enough. Is this something that you believe should maybe be taken to maybe the House of Reps, House of Senate, something that should be passed into law, that it is made compulsory for children to receive these immunization vaccines? I
really like your line of thought. So to bring it home in terms of the numbers, so the global target has been set for 90%. And the 90% we aim to get there in 2030. So we're 7 years to catch up. We are at 57%. We have a long, and for us to get 57%, we've done several years. And we've been set back again by COVID. Because we realized that in 2021, 25 million children didn't get the vaccine. and that's 6 million more than in 2019. So COVID has set us back again, and several reasons why COVID set us back, including resources that would have gone to routine immunization, going to COVID, the fight to COVID. So there was a diversion of resources. Another reason was that, you know, there was a lot of focus on ending the pandemic. So everybody just sort of left a lot of the services, program activities were around COVID and sort of left the essential healthcare service providers. So we have been set back. How do we catch up, your question? This catch-up is very necessary because only in Nigeria we have over 840,000 children dying annually from vaccine-preventable diseases, under 5 mortality alone. So it's a huge burden. This is close to 1 million children, under 5 children dying yearly. That is a huge percentage, and that should create burdens in our heart. How do we close this gap faster? Again, everything lies and falls with leadership. So it's time for us to leave our pretty offices and really find out what we can do. We can't leave it for only community leaders, like you rightly said. How do we push this agenda? Political will. Without political will, nothing ever really gets done. If there is no interest from the top, if there are no policy agendas, a lot of this 90% targets, Nigeria also pledged to it.
Yes.
We took the commitment. How are we accountable to our people based on that commitment? Are we accountable to the media based on the commitment? We need to track accountability. We need to track transparency. You can't just make a commitment. What are you doing to meet up that commitment? Again, you are 100% correct. The leaders need to roll up their sleeves, and they need to go back to saying, are these programs working or not? What can we do to work? In the issue of policy, and then there will be a lot of human rights conversation comes in, the rights for human to be able to, you know, make a decision for themselves, especially when it's not life-threatening as it were. So there'll be other conversation, but we can do a lot more.
Well, we definitely hope you catch up as quickly as you can, as the theme suggests. That we've definitely enjoyed having you here on Newsday. General Manager, CEO, Nigeria Solidarity Support Fund, Dr. Fejiro Nwoko. Thank you so much for joining us on Newsday, and all the best.
Thank you.